Edition this morning.
Welcome back. In a rare move, the State Budget and Control Board is allowing a state agency to operate in more than $100 million debt, and it is growing. The Department of Health and Human Services says that it's because of growing Medicaid costs nearing $225 million over budget. Now, a little background on this. Medicaid is the health program for low-income families, children, and those with disabilities. Medicaid is jointly funded by the federal government and state government, but run by each individual state. Doctors require reimbursements from the Medicaid fund for the services that they give to patients, but those payments have been slashed to save money, and hospitals are also feeling the pinch and are watching this debate very closely. Thornton Kirby leads the state's hospital association. Thank you so much for coming in this morning.
It's a pleasure. Thank you for having us, Hannah.
Kind of explain, give us a little bit of background behind the headlines here. A lot of people don't realize that this is a debate that you are all watching and are coming to the table with a solution. What are you proposing?
Well, thank you for the opportunity to talk about it. The first thing I would say is our primary focus is always on patients. That's why we exist. We want to care for patients, and our first concern is whether the patients in the state will be taken care of. If we have substantial reductions in Medicaid funding, there really are three very significant adverse things that will happen. First of all, fewer physicians will want to see Medicaid patients because it's a difficult burden for them financially when they're not being paid well for that. Secondly, those patients who aren't seen by physicians will go to emergency rooms, which are often already crowded, and that will cause greater backlogs, and it's also a very expensive place to get care that should be provided in a doctor's office. And third, because you've got more uninsured patients coming to hospitals, hospitals have to shift those costs somewhere. It may be free to the patient because they can't pay, but there are costs associated with it that have to be borne.
Somebody's picking up the tab.
That's
you all
correct.
have proposed to provide an increase in the contribution hospitals that you make to the Medicaid program. Is your voice being heard, or legislators willing to accept this as a solution?
Well, our voice is being heard. They are considering it, but there are obviously concerns because we're in a period of time when no one wants to raise more money from through government. But here are the key facts. You pointed out correctly that the Medicaid program is a state-federal joint program. Now, in our state, when we put $1 up as a state, the federal government puts $3 in. So that's $4 of total spending for every $1 that our state invests. Well, when you take that out, it has a negative impact, and hospitals are concerned that because federal law requires them to see every patient, that we're not going to be able to save the costs by not paying for the patients. So what is the solution? Hospitals are willing to put up voluntarily more funds to support the Medicaid program. Our thinking as a hospital community is paying $1 is better than losing $4.
And when you consider the economic impact of the healthcare industry in our state, it is enormous. The number of people, not patients they see, but the number of people who are just employed by this industry is amazing.
Right.
In our
and
area.
We need to remember that when Medicaid makes payments, they don't make payments to the beneficiaries. They make payments to physicians and to hospitals, and those are jobs.
Keep us posted on this debate, and we'll continue to pass along the information.
Thanks for your coverage of it.
Absolutely. All right, folks, we will continue to cover this debate that is happening in the legislature. If you would like to learn more about the Hospital Association, of course, their website, contact them. They'll send you more info. We're back right after this. Stay with us.
I'll take it from here, Hannah. Take a ride outside on your roadways. Of course, we've got your major highways.